By the Australian Institute of Health and Welfare also found that people are being slugged with $3 billion in out-of-pocket medical expenses every year, despite bulk billing rates being at an all-time high. The latest Australian Institute of Health and Welfare study shows more than half of that money was spent on specialist and GP services. Shadow Health Minister Catherine King says costs are getting higher for patients.
This latest report by the Australian Institute of Health and Welfare puts a spotlight on the health affordability crisis that is happening in this country. We know that Australians are now paying $3 billion a year for Medicare rebatable services, a gap that is expanding. We know they are paying $30 billion a year for health costs.
Alison Verhoeven is the head of the Australian Healthcare and Hospitals Association. She says the figures indicate the medical system needs to change.
It's very distressing that around 10% of Australians say that they've avoided seeing their doctor, a GP or a specialist because they can't afford health care. And what's really sad about that is that many of these people will become very unwell, their health will worsen, and they will end up in our hospitals where it costs even more to provide care. So this is really a bad news story for those who can't afford health care, but more importantly also for the whole country. Bulk billing rates actually talk about the service items that are charged, not the people who are charged. So many doctors do see children and people with concession cards and bulk bill them. But it's actually quite difficult in many areas of Australia to find a GP or a specialist who will bulk bill your care if you're not a child or you're not on a concession card. So these are the real problem areas for us. We know, for example, that women seeing obstetricians pay on average $250 per item charged for them out of pocket. That is a lot of money, and people simply can't afford to pay that kind of contribution for their care. We know that GPs in particular have suffered under the Medicare freeze now for several years. So this is about ensuring that we have a well-funded primary care system to ensure that GPs can provide services such that their practices are financially sustainable, but also that patients can see a GP when they need to. It's simply not good enough to keep charging patients out-of-pocket costs, seeing them avoid their doctors and ending up in hospital requiring acute care services. That's not good for anyone, neither for the taxpayer nor for the patient. We know that 70% of people who see a specialist pay an out-of-pocket cost, and at 10% of them are paying around $170 for a visit on average. So these are large sums of money, and particularly when people are very unwell and they may have multiple illnesses, these can mount up very quickly. So overall, $30 billion is contributed by Australians each year to their health costs. So it's not fair to say that Australians aren't paying their own way. They definitely are, $30 billion. And on top of that, 50% of Australians are also paying for private health insurance. So the contributions out of pocket are substantial. Depending on where you live, you will be more or less likely to be bulk billed. And that's not good enough either. It shouldn't matter where you live in Australia, and it shouldn't matter how much money you have as to whether you can afford health care. Look, I think there's some really radical reforms that need to be done in our health system to ensure that the primary care system, general practice, and the acute care system are better integrated to ensure that we keep more people in the primary care space. So we must address the Medicare freeze. That has to happen as a matter of urgency. And we really do need to start thinking about ensuring equitable care across the country, not just seeing patchy access to care and seeing affordability being driven by what you have in your own back pocket, particularly in the area of specialist fees. These are the particular problem area, I think, in the health system, and I applaud the government for setting up an inquiry into that, but that inquiry needs to speed up its work and it needs to listen to some consumers and the electorate. It shouldn't just be conversations with doctor groups. This needs to be an all-encompassing conversation with the Australian electorate about what we want out of an Australian health system, and particularly whether we can aspire to ensuring that all Australians have access to care that they can afford.